Major Trauma Network consists of a number of hospitals and emergency services working collaboratively to improve the care of major trauma patients. Evidence indicates that major trauma networks improve the survival of major trauma patients and, importantly, improve the short and long-term outcome of patients.
So as a paramedic with the Welsh Ambulance Service, our role on scene will be to treat patients that have suffered serious life-threatening injuries and make sure that we get them to the right hospital at the right time. We will work closely with our EMRTS colleagues and the Welsh Air Ambulance.
EMRTS and the Air Ambulance provide a more rapid transport platform for those patients, but it also carries a crew, and they're able to provide essentially the same care as an emergency department. At the scene, they're able to stabilise patients sufficiently to make that transfer to hospital that will give them the definitive care they need in a safe manner.
Patients that experience major trauma now will get taken straight to the Major Trauma Centre in Cardiff, even if it means bypassing their local hospital. In some cases though, patients that are really severely injured and they've got major problems with their airway or they've got bleeding that can't be controlled, those patients will still come to designated trauma unit hospitals and then be transferred once they're stabilised to the Major Trauma Centre.
Patients transferred in from anywhere across the network will be met by a trauma team who will be able to rapidly assess and treat and stabilise their condition. They will have access to all the equipment that we require to be able to deliver care for patients who are seriously injured. We then facilitate the ongoing rapid transfer of patients through to more definitive care, such as life-saving damage control surgery in the operating theatre or movement onwards to our polytrauma unit or intensive care unit.
We as major trauma practitioners would firstly tell the patient, if they're conscious, what is happening and what to expect. We would also be there to explain that to the patient's families. We would be the patient's key worker and would be very active in coordinating their care throughout their stay in the Major Trauma Centre.
It's very important that once patients have had that acute treatment done, they get back closer to home, so they're nearer to their family. It's much easier to sort out their rehabilitation needs and to sort out any ongoing social care problems.
Ar ôl I rhywun cael anaf dwys, mae nhw'n gorfod dygymod efo beth sy'n digwydd efo nhw, mae bywyd nhw wedi newid, felly gwedd newid, a mae eisiau help a chymorth I ddeall sut maen nhw'n gallu helpu hun, beth sy'n mynd I ddigwydd nesaf, sut maen nhw'n mynd I dirwyn I taith nhw trwy physiotherapy a psycholeg a'r pethau sydd yn hanfodol iddyn nhw wella hyd at y gallen nhw trwy ar ôl I rhywbeth fel hyn I ddigwydd.
The mission statement of the network is to save lives, improve outcomes and make a difference. More patients will survive.
And they're also more likely to go back to doing the things that they were doing before their injuries and to have a better quality of life, which is something that we would all aspire to for our patients.